When does Medicare Part B purchase equipment? Imagine needing a wheelchair or a hospital bed and wondering how Medicare can help. Well, understanding when Medicare Part B covers medical equipment can make a big difference. Medicare Part B is the part of Medicare that pays for outpatient services and certain medical supplies. It covers durable medical equipment that you need to use at home. But it only covers equipment if your doctor prescribes it as medically necessary. That means your doctor must confirm the equipment is essential for your health. The equipment must be durable, which means it can withstand repeated use and last at least 3 years. Items like wheelchairs, walkers, hospital beds, oxygen tanks, and nebulizers fit this category. They are designed for long-term use and are not just temporary solutions. To qualify for coverage, the equipment must serve a medical purpose and not be useful to someone without an illness or injury. For example, a cane prescribed for mobility issues is covered, but a regular shopping cart is not. The equipment also needs to be suitable for use in your home, not in a hospital or nursing facility. You must get the equipment from a supplier enrolled in Medicare. If you have a Medicare Advantage plan, the supplier must be in your plan's network. This helps ensure the equipment is covered and that billing is handled correctly. Medicare usually rents expensive equipment like wheelchairs and hospital beds for up to 13 months. After that, the equipment becomes your property. For less costly items like blood sugar monitors or canes, Medicare typically purchases them outright. Your costs depend on whether you have met your yearly Medicare Part B deductible. Once you pay that, you generally owe 20% of the Medicare-approved amount for the equipment. The supplier must accept Medicare assignment, which means they agree to accept the Medicare-approved price as full payment. If they do not accept assignment, you might pay more out of pocket. To get your equipment covered, talk to your doctor about your needs and get a prescription. Make sure your doctor and the supplier are enrolled in Medicare and that the supplier accepts Medicare assignment. The supplier will bill Medicare directly for the covered part. There are some special cases to keep in mind. For example, if you live in a long-term care facility that does not mainly provide skilled nursing, that might be considered your home for DME purposes. Also, during emergencies or disasters, temporary rules might change how coverage works. In summary, Medicare Part B covers equipment when it is medically necessary, prescribed by your doctor, and obtained from an enrolled supplier. Whether you rent or buy depends on the type of equipment and Medicare's rules. Always check with your doctor and supplier to confirm coverage and costs. For the most accurate details, visit the official Medicare website or contact Medicare directly.